The country's top infectious disease expert, Dr. Anthony Fauci, sounding a major alarm about the future of professional sports this fall. CNN's chief medical correspondent, Dr. Sanjay Gupta, he spoke to Dr. Fauci. Tell us what he's telling you.
Yeah, I mean, there was concern, as you guys have been been reporting regarding baseball and when that season, if it was going to happen, when it should likely end, given a possible resurgence of this virus in the fall. So that brings up the question about other sports, and I talked to Dr. Fauci, asked specifically about football because obviously a later season. I show you a little bit of what he said. He obviously has concerns, but bringing up this idea that in order for this to work properly, in order for a team to be able to do this, players would essentially have to be inside a bubble, not really having significant interaction from the community. They need to be tested nearly every day, and it would be hard to see how football, he said, would be able to be played, given that there's likely going to be a second wave and a predictable flu season. If you start to add in all these various things, you can see the last line there, football may not happen this year. So unfortunately, the season starts, the training camps start end of July. The season starts in September. This is the exact time, I think, as many people know, where two things could be happening at the same time. You could get an uptick. I won't call it a second wave because that would imply that a first wave has come and gone. We're not there yet by any means, but you could still see an uptick in the September and the fall months. And then, flu season, which begins end of September, early October, on top of that, could really worsen things as well. So legitimate concerns that Dr. Fauci's raising there.
Sanjay, let me put up for you and our viewers what's happening in Florida right now. We have a graph of the cases and how they have developed over the past months. So you can see a big spike in cases in the past week. So some scientists and modelers have suggested that Florida is the new epicenter of coronavirus. What do you think?
Yeah, I think what we're starting to see, the big concern always has been when you start to reopen, you knew there was going to be an increase in the number of people infected. So it was a question, is the line going to go from here to here, like that, and then sort of stay at that higher level of plateau? I think the concern has always been, does that then turn into exponential growth? Think of it like a big steamship, right? The big steamship is sort of plodding along slowly, but now it's gaining speed. And if it gains significant speed, it becomes really hard to slow down. It becomes sort of a runaway ship. So, that is the concern, I think, in Florida, amplified by this idea that we have identified who the vulnerable populations are to this disease. A lot of people are going to get the infection and have very minimal symptoms. They may not even know they had it. They say some 80% of people will be like that. The problem is, you start to superimpose that on vulnerable populations, elderly populations, people with pre-existing conditions, and it turns into a real problem. Then it's not just cases, it's hospitalizations and sadly, deaths. So there's always a lag period here. We've been watching those numbers in Florida very, very carefully. We've been watching numbers in many states carefully. You talk about new epicenters. Arizona, within the next couple of days, may surpass where New York was at its highest level with regard to hospitalizations. Arizona is a state that is 1/3 the size in terms of population of New York. So not only could this be, as bad, it could be worse in some of these other states.
Sanjay, we know who's not doing it right. State like Arizona, for instance, Florida, in that, and that's based on the White House's own standards of this, right? I mean, show 2 weeks of a downward trend in cases, and then you can reopen. So we know who's violating those standards, and you're now seeing the results of that. Who, if anyone, is doing reopening well, in your view? Which states are following the guidelines, contact tracing when they have outbreaks, et cetera?
I mean, it's there's been a few states that have, Washington State sort of, I think, was an example. They had the first confirmed diagnosis, and I think part of the issue is that contact tracing can be done right if you don't have sort of explosive growth. So if you're able to do this early, get testing done early and contact tracing done early, then I think it makes a big difference. The problem is that, we are the United States, so people are still moving around. If you have a particular community or a particular state where things are going well, but then you have an influx of people from other states, it can be a real problem. If a state opens early and then other people start to visit that state, it can be a real problem. So it's hard to hold up a particular model here. We know that it doesn't mean that it can't be done. We know there's places around the world where you've had successful implementation of these basic public health policies, and they've been able to really reduce the explosive rate of infections and explosive rate of hospitalizations. I hope that we can still do that here. I think we're gonna have other chances to do that here. The problem is it's kind of like we've got partway through the treatment. Patients started to feel better. Oh, this treatment's working. I feel better. I'm going to stop the treatment and just go back to things as normal. That's like stopping antibiotics early, stopping chemotherapy early. What happens? The disease comes back.
Sanjay, we know that Dr. Fauci hasn't met. He said he hadn't met with President Trump for weeks, but that yesterday he was going to be briefing Vice President Pence. Did you get any scoop out of him about that?
Well, you know, it sounded like it was a routine meeting. I mean, I know that they were going to talk about the increased levels of rates of infection in many states, talk about making sure that there was enough supply chain issues, talking about potential new treatments. But the idea of the disconnect between testing and levels of infection, I don't know how much of that came up. There was not a lot of insight into this meeting. It was a private meeting. A lot of these meetings are being done via phone nowadays. So, you know, it's tough. I mean, this is a separate group that sort of banded together, the doctors group that came together to basically try and provide as much input as they can. Mm-hmm. I think what it's tough to get a sense of for me and a lot of other people who are digging into this is just how much are they being listened to.
Well, if you base it on the president's comments, denying the data does not appear that they're listened to. Dr. Sanjay Gupta, thanks very much.